Now, the Council of Governors Health Committee has raised concern over the increase in community transmission in counties outside the mapped disease zone area, consisting of 5 counties. According to Professor Anyang Nyong'o, the committee chairperson, the scenario will greatly affect the country's agenda of flattening the curve. This comes after the government clarified that the ongoing curfew in the country will be enforced until the 27th of May, 2021. Let's begin our broadcast with our very own Raquel Muigai.
Good afternoon.
It is almost 3 weeks since President Uhuru Kenyatta announced a new raft of measures in a bid to combat the rising number of COVID-19 infections in the country, to the point of restricting movement into and out of 5 counties now identified as a disease-infected area. Despite that, however, the County Government Health Committee is raising an issue of concern.
We note that community transmissions have started increasing, and other counties out of the zoned area, that is mainly Nairobi and Nakuru, are experiencing a surge in COVID-19 infections, including my own county, Kisumu.
The positivity rate in the first week of the President's announcement has been 18.1%. The week after, between the dates of 2nd March and 8th March, the positivity rate dropped to an average of 16.6%. This week, the positivity rate stands at an average of 13.9%. And according to data by the Ministry of Health, today's positivity rate stands at 13% after 981 people were infected with the virus. Counties of Nairobi, Bungoma, Turkana, Kiambu and Kisumu registering high number of infections compared to other counties.
As county government, we will strive to ensure strict adherence of health protocols by all counties, especially those outside the zoned area.
And with only 1,623 patients being admitted in various hospitals around the country, 269 of them being in the intensive care unit, Professor Anyang Nyong'o says the availability of beds in ICU and HDU wards is not of concern. According to the Council of Governors, there are 390 ICU beds and 156 HDU beds in the country in totality. Moreover, county governments say delaying disbursement of funds is interfering with their mandate of serving the people, especially during the COVID-19 pandemic, as no county has received their share for the months of February and March, which include 26 billion shillings and 25 billion shillings respectively.
In the last 1 week, the National Treasury has disbursed a total of 19.8 billion shillings to county government, following our appeal last week. The current outstanding amount owed to county governments is shillings 66 billion.
And as the counties await the Treasury to fast-track the disbursement, as well as communication from the Ministry of Health on the way forward regarding the availability of vaccines, the government, through a Gazette notice, has clarified that the ongoing curfew in the country will last 60 days. According to the notice, the ongoing 8 p.m. to 4 a.m. curfew in the 5 disease-infected counties and the 10 p.m. to 4 a.m. curfew in the remaining 42 counties shall remain in place for a period of 60 days from the 29th of March, which makes the last day the 27th of May. Raquel Muigai, Citizen TV.